Hello everyone, I'm Dr. Timothy Keenan. Today I'd like to show you the best way to heal persistent mid-back pain yourself. Lean back onto the corner of a wall or door frame in the area of your pain. Cross your arms, then move your feet and pelvis away from the corner while keeping your legs straight. Hold for 10 seconds without rubbing and do this 6 times a day. This is the rhomboid muscle. If your pain is lower down in the mid-back, bend your head forward while pushing your pelvis out. If your pain is higher up, arc your back. If your pain is just behind the shoulder blade, slide yourself sideways onto the painful spot. If your pain is in the middle of the mid-back, treat both sides. If it hurts yet feels good at the same time, you're doing the right thing. It's so easy. The weight of your body does all of the work for you. Add this stretch to your daily routine, especially if you are in public or sitting for long periods of time. Pull the arm of the affected side forward and hold it for 10 seconds. If your pain is lower down, raise your arm higher. If your pain is higher up, lower it. It's that simple. Try it for a week. If you feel improvement, continue treating yourself at the same intensity until you're perfectly healed. If you have less fatigue and pain in your mid-back at the end of the day, and if it's easier to breathe, it's proof that you're healing and you should congratulate yourself. If you treat yourself as I've described, you should be completely healed in 1 to 3 weeks, depending on the severity of your condition. When you start, it's normal to have sensitive skin for 3 to 4 days as your body eliminates stored-up toxins. If it's too painful at first, start closer to the corner. If you'd like to slide easier on the corner, cover it with a plastic corner protector that you can buy in a hardware store. Never apply heat, including hot baths, since heat increases inflammation. If you've just hurt yourself, you may apply ice for 15 minutes 4 times a day for 3 days in order to reduce the inflammation. In order to accelerate healing, avoid tight bra straps or change to an athletic-style bra. Drive with both hands on the wheel, and change arms often when vacuuming, carrying children, or using a computer mouse. Never pull your shoulders back to relieve your pain. Instead, pull the arm of the affected side forward. Once healed, if ever you feel the pain coming back, treat it immediately before it gets worse. Finally, in an effort to clear up the confusion surrounding the real cause of mid-back pain, if you heal yourself using my method, it's scientific proof that your mid-back pain was caused exclusively by contracted soft tissues, since that's all my method corrects. This means that even if you can see osteoarthritis, what most people call arthritis, fibromyalgia, osteoporosis, spinal stenosis, scoliosis, misaligned vertebrae, subluxations, pinched nerves, a short leg, or degenerated, slipped, thinned, bulging, or herniated discs on your X-rays, CT scans, or MRIs, they have absolutely nothing to do with your pain, so you can ignore them. Only 5% of mid-back pain is caused by things other than contracted soft tissues, muscles, ligaments, tendons, and fascia, so you have a 95% chance of healing yourself when you use my method correctly. That's all you need to heal pain yourself. If you have any questions, feel free to write me. Bye for now, and happy healing.